It seems that every day brings more news stories about the opioid crisis. Too many pills being sold, drug abuse on the rise, and people dying needlessly. One aspect of the opioid crisis has been called a hidden epidemic, medication diversion. Quite simply, diversion is when legal prescribed medications, either in hospitals or in our homes, are converted to an illegal or irresponsible purpose. Sadly, doctors and nurses who care for us with their own substance abuse issues are often the cause of this epidemic and are often its victims. Medications are diverted when there is too much left over once the patients are given theirs. Unfortunately, most hospitals and other care locations have no procedures for properly handling this excess medication, called medication waste, to prevent it from being diverted. Frequently diverted medications are pain medications like morphine and fentanyl, as well as anesthetics used in operating rooms. A typical community hospital discards more than 120,000 unfinished doses of these medications each year. Healthcare professionals can divert because their hospitals don't require them to account for the extra medication, so they just take it themselves.
There was no requirements on what happened to those pills. They could go down the toilet or they could go in my pocket.
It may seem shocking, but every day there are thousands of diversions of legal prescription medications. We're not talking about street drugs or counterfeit pills, but rather real medications ordered by prescribers for patients' needs. Experts tell us that more than 300,000 nurses and doctors have substance abuse issues. Yet almost none of those caregivers diverting medications get caught. Sadly, we hear about drug diversion cases when hospitals are punished by the federal government for loose and improper medication controls, to the tune of millions of dollars of fines and other remedies. Or when impaired doctors and nurses injure or even kill patients, such as depriving patients having surgery from important painkillers during their operations.
The nurse stole drugs and then replaced them with saline solution so the victims did not receive proper anesthesia.
As a result, women undergoing egg retrieval treatments endured horrific pain.
Or even worse, when medication is diverted and consumed on the job.
They're estimating that healthcare professionals are experiencing 5 times the rate of abuse and addiction.
2 nurses in Texas were found dead on the job. They took patient opioids, injected themselves, and overdosed. When this happens, we all pay a steep price. This problem doesn't just happen in hospitals. Wherever there are medications stored, they can disappear without a trace. This happens at pharmacies, nursing homes, surgery centers, prisons, and even at police and government locations where medications, legal or not, are stolen from supposedly secure facilities. There is no good solution to prevent medication diversion and its terrible consequences. The hidden epidemic continues. MIDAS is changing that.